University. All right. So causes of abortion and wait, how do I? Oh, okay. So I just move on. All right. The first slide I want to show you is this toilet. Okay. So what is it written here? The devil is in the details. Okay. Actually, this photo was taken in 2002. That's about 20 years ago at the Chitose Airport in Sapporo. During that time, you see, I was impressed by this toilet. It's not because of this high-tech gadget. It's the simple thinking. You look at this button. It says press during emergency. When you are not feeling well, you press this button and then help will come. But the things that I want you to see is the button down here, you see. If you are not feeling well, you will fall down to the floor. And once you're on the floor, you will not be able to stand up to press this button. So they put another button here so you still could be safe. So this is the devil in the details. So if you just stop and think and look around the your environments like your toilets and things like that, you imagine yourself in that situation. You fall down and you want to ask for help. And this is the place where you can just pull and then you can get help and not here. Okay. So I'll just move on. Oh, sorry. So this is the kettle, dairy kettle, that was taken about 30 years ago in Hokkaido in Japan. Okay, and what I want to show you is that actually kettles, they have their own what you call the the radiating system. So if you put 200 kettles in a kettle shed, in an enclosed kettle shed, that means you are having 200, about 400 watts of this radiator. Okay,
Okay.
they will radiate out a lot of heat, so they are able to stand in the snow. All right. So since most, I think all of you are veterinarians who are listening, we always say that what is the basic concept for a veterinarian is diagnosis, therapy, and prophylaxis. And for this diagnosis, and we can classify diagnosis as non-infectious causes and infectious causes. So now let us take this abortion in cattle as an example. For example, you don't go to a hospital if you don't feel a stomach ache or a headache or some other clinical signs. You only go to the hospital to be examined when there's something wrong with your physiological being. And abortion is one which is not normal. And farming is basically an economic activity. You need to make a profit in farming. Okay, it's not a charity. It's an economic activity. So, well, in terms of a midterm abortion, for example, if your cattle, your dairy cattle, just aborted at 5 months post gestation, let's look at this abortion at 5 months. So, how much does it cost? I try to translate this into Indian rupees, okay, INR. So, well, we buy sperm costs from like Canada and all these places, you see, or even within your country, it costs around there. Of course, there is a range, okay? And then for 21 days after aborting, and then it takes another 2 months for re-insemination, it will cost you so much, 117,000. Well, anyway, labor costs and everything. That means you are going to make a loss of 150,000 rupees with a 5 month abortion in the cattle. So this is the money that goes out. So, well, if there is no abortion, then this is the money that will come in. I'm using this in Japan now. One cattle will give you 10,000 kilos in 305 days. We measures the the capacity, the ability of the cow to give milk, lactation in 305 days. This is animal husbandry. And so about 1 day, it will give you 32.8 kilos per day. See, and then in Japan, we sell for 80 yen. And if you translate into, maybe it's not that expensive in India, but I'm just giving you an idea how much it costs. And then the male and then the female calf, you see. So for 210 days, you are supposed to get so much money, okay? Well, in yen in Japan. And then you don't get this much money. You don't get this much money coming in, and you'll be making a loss of this much money, okay? That goes out. So, so the economic loss for a midterm abortion is very high, okay? Even in Japan, I guess it's everywhere, right? So we move on. Well, you might want to ask me why Japan, cattle in Japan can give you 10,000 kilos of milk in 305 days. It did not happen overnight. It was due to all these, what you call genetic selection and everything, you see. So in 1975, the amount of milk given per cattle at 305 days was only 5,800. And then 1980, 85, it started to grow. Until 2000, it was already 8,700. Now in Japan, if your cattle is less than 10,000 kilos, giving you less than 10,000 kilos in 305 days, that means you go to the slaughterhouse. Okay, so that's how it has evolved. So you see all these the minimum and maximum, and it takes 25 years to come to this, and then another 20 years to more than 10,000. Okay, so how they do it, of course, with all this a lot of this is in Japanese. Sorry, it's like a concentrated field feed and milk feed and conversion protein and everything. Okay, so I just want to tell you, in India, I would have supposed maybe if your cattle is giving you 8,000 kilos, then you be considering it as very good already. But here in Japan, it's not viable. They just send you for slaughtering. Okay, and in Japan, in nowadays they only have maybe three calves, less than four calves usually, two or three, and then they move to a new cattle. Previously, some cattle will give birth to six calves. That means six times, you see, five, six, seven. Okay, and they found that those older cattle do not give as much milk. Certain cattle is now only two or three cycle, and then they move to a new cattle. Okay, so this is the present situation, the new situation in Japan, and how they are moving on. Okay, so we look at this aborted fetus. Here we can see that, of course, this fetus is quite late in gestation. Okay, and here we can see these black cattle that has been absorbed. Okay, why is it like this? Uh, doesn't you don't you wonder why it's like this? Well, actually, this fetus died in the uterine, and it was not what you call excreted out or excreted out. Okay, so it stays in the uterine, in the womb, and then this fetus got absorbed, get dehydrated, so it's mummified. All right, and well, I've been working on Neospora, and in Neospora, we look at the fetus brain. There are no changes at all in fetus brain and even in the spinal cord. Okay, so let's move on. And well, I said that there are infectious causes and non-infectious causes of cattle abortion. So let's look at the non-infectious causes. What do they have? Chemicals, drug. These are all these can be found in the textbook. Okay, so I'm not going to go through. Just to remind you that is chemical, drugs, poisonous plants, hormonal, nutritional, genetics, chromosomal, physical. And then the infectious causes, of course, you have the virus, bacteria, rickettsia, fungus, and parasites. Okay, so now let's look at these non-infectious causes of cattle abortion. Chemical and drugs. You know naphthalene, the mothball, the one that you put in the cupboard of your clothing. Okay, that's the naphthalene. It can cause, of course, arsenic is a poison. Pine leaves, it sticks. Okay, perennial brooms, and then You look at this nitrates. Okay, I'll tell you why we get nitrates. Next, you have hormonal. Of course, this you have studied in your therogenealogy or animal reproduction. High level of estrogen, lack of progesterone, and glucocorticoid. Okay, and of course, prostaglandin F2 alpha is a hormone that you use to induce abortion. Okay, for example, when your gestation has come to term and then you want to get the baby out, you just inject prostaglandin F2 alpha. They do this in human medicine too. Okay, and then starvation, of course, vitamin A. I'm not going to go through all this. You just take a look at this and artificial insemination. Okay, so we move on. So the next question is that, all right, if we go back, we look at these nitrates. Okay, how does nitrate gets into the pregnant cattle? You might want to ask. Okay, use of excess nitrate in fertilizer in the grassland, especially in the stalk of grass, the hay. Okay, stalk of grass. They put a lot of nitrates so that the grass will grow very fast. But this grass will take up the nitrate and then they become hay. And when the cattle eat the hay containing the nitrate breaks down to produce ammonia. And when you have a lot of ammonia in the cattle, the pH rises in this cattle. So it will, and when the pH rises, the placenta could not hold on to the to the fetus, so it causes abortion. Okay, so how do you make a diagnosis of these nitrates in the hay? Very simple. This is my experience. I experienced this in the farm. I went to the hay and then take the hay that the cow was eating, and then I just put the hay into copper. I think it was copper chloride, which is colorless. And then when the hay dipped into the copper chloride, it became blue or it became purple because copper nitrate is purple in color. Okay, so this is a very simple way to show that there are a lot of nitrates in the hay. And the next thing is that where does this glucocorticoid come from? Okay, well, my experience with the farmers that was in Taiwan is because some of those salesmen who went to the farm, they belong to this pharmaceutical company, and then they sell the farmers antibiotics. And when they did not tell the farmer that these antibiotics also contain dexamethasone in these antibiotics, because when you inject, when you have mastitis and then you inject these antibiotics, if you add dexamethasone, the the thing will just become very what you call soft. Okay, the well the mammary glands. Okay, and then sometimes glucocorticoids are contained in the teat gels. You see, after milking, sometimes we put the gel. Okay, we put the gel into the teats. Okay, to prevent mastitis. So it contains teat gel. So this is where glucocorticoid, and this since this glucocorticoid goes into this kettle body, they just get. I mean, they produce abortion. All right. So okay, that's the non-infectious, and those are my experience, my real experience. Okay, it's not written in the textbook, so I'm telling you things that are not written in the textbook. Okay, that is more important. Otherwise, you can just read the textbook. Okay, infectious agents, we have prion and then all these virus, bacteria. This is generally, okay. These are all the infectious. For example, I will ask the student, what's the difference between the bacteria and the mycoplasma? Okay, it's a cell wall. Okay, like rickettsia. Okay, is well transmitted by arthropods. Actually, is rickettsia is gram-negative bacteria, right? And then these are all blue because they are prokaryote. That means they do not have nucleus in their cell. And the yellow one are fungus. I mean, fungus, protozoa, and these are eukaryote. That means their cell contains the nucleus membrane. And the chromosomes, well, most of the chromosomes are packed inside the the nucleus. Okay. So, well, just this is just for the students' reference. Prions. So, what are the prions? Now we know all these prion disease like well, man in human. You have Kuru, the Creutzfeldt-Jacobs, the GSS, Gerstmann-Straussler. So this is in human, and then goats and sheep we have the scrapie. When I was a student, this scrapie was called a slow virus, but now because prion was not discovered yet in the 1980s and 1990s, okay, we were still calling it slow virus. And then of course you have for the deers the chronic wasting disease, and they are mostly in North America, and I think Europe also has been this disease has been reported, and then the BSE. Okay, I have to move fast because there might not be enough time. So let's look at the virus that causes abortion. Okay, here we have the IBR and then how they are uh, what you call transmitted. So the point here is that if you look at the white part, these are all the differential diagnoses. So a veterinarians, you have to look at these differential diagnoses. So what do you do? So for all fetus, I would recommend that you do a necropsy. That means you cut out the brain, okay, and look at the brain. So fetus without cerebellum, fetus without cerebrum, and of course you have the brain with all filled with water or arch joints. Okay, here you have the BVD and Akabane. Okay, this is without cerebellum. This is without cerebrum. That means the big brain. This is without the small brain. Okay, and arch joints, and of course they are transmitted by these colicoides and mosquitoes. Okay, and here too, you see the rhinovirus and fetus with underdeveloped cerebrum. The cerebrum will be very, very small, just like that, and it's all filled with water. Okay, and then of course with the same arch joint syndrome. Arch joint syndrome, but then is like this, and then the spine just look back like this. Okay? And then the Chuzan disease, and of course fetus without cerebrum. Okay, and but for Chuzan disease, the abortion is quite rare. Okay, is what you call stillbirth. Then we have the Ibaraki disease and the bovine respiratory syncytial virus. So what's the difference between these two? Is uncontrolled flow of saliva. That means is due to the swallowing difficulty, paralysis of this esophagus and laryngeal muscle. So they cannot swallow. And here is with air bubbles. It's a paramyxo. Okay, so if you see the saliva with lot of air bubbles, then maybe this might be bovine respiratory syncytial syndrome. But just only saliva, maybe it might be Ibaraki. Okay, so this, and of course you have the Rift Valley virus. This is usually in South and East Africa. Okay, transmitted by mosquitoes, and blue tongues by colicoides. And of course, you can see all this. You can read all this in your textbook. So we just move on. All right. So this is the aborted fetus, and you see the arch joint, and then the head. Okay. And next, we open up the brain, and maybe I should use. Wait, let me see. Hmm? Oh, well, never mind. Okay, so I just open up the brain and cut up the brain, and then there's a lot of water inside here. Okay, well, the problem is that in those days, this was taken, I think, more than 25 years ago. We see these photos. In those days, we don't have digital cameras. We use the what you call the Nikon, the 36 the roll of film. So, well, the problem is that these are my hands, you see. I did the necropsy, so I could not take the photo. So I asked one of my students to take the photo, and this is the results. it was a great mistake. Okay, so we could not see properly, and anyway, there were no cerebrum, and the cerebrum was just very small. Okay, so well, anyway, these are all my hands. So here we can see a comparison of Akaban, Chuzan, and rhinovirus infection in cattle. Okay, so these are all the clinical and post-mortem findings of the fetus. So we see arch spines. Okay, actually the answer is rhinovirus, and here we see underdeveloped cerebrum, whereas in Akabane, the cerebrum is quite developed. Okay, but since of course these are all we got cerebrum, and the cerebellum in Akabane you still can see the cerebellum, but not in rhinovirus. So the one that I showed you just now was actually rhinovirus. Okay, with all the arch spines and then a little bit of swelling of the head. Okay, and okay, so I move on. And next, we from virus we go to bacteria. So brucellosis, of course, this thing is a big problem. I think in India too, and other Southeast Asian country. Okay, and if you are working with brucella, uh, just be careful, especially men, you see, because we get what we call the inflammation of the scrotum, yes, scrotum. That means the pouch that your testicle is inside, and it's inflammation, and it's very very painful, because one of my colleagues in Taiwan, who was working on brucella, and then he got infected himself. He's a scientist, and actually he has already passed away, and from his experience he says it's really really very painful, and hope that you don't get infected with brucella. Okay, so next we look at this Campylobacter, and of course it's through copulation and bacteria. I'm going to move on very quickly. Salmonella, you have high fever, and then of course with leptospirosis too, you see, and listeriosis, and the bacteria are shed in milk and uterine discharges. So you have to be very careful with listeria. Okay. So we move on from listeria. We move on to rickettsia. Rickettsia is chlamydiosis. Okay. In the case of chlamydiosis, is late term abortion. That means, well, maybe at the 8th month of pregnancy, or maybe 9 months, seven to 9 months. Okay. And fungus. Okay, this has been reported, I think, in Australia, that Aspergillus does causes abortion too. And of course, parasite. One is trichomoniasis. Okay, uh, transmitted through copulation. The other one is neosporiosis. Of course, you can have the transmission by oral injection of oocysts, and then point source infection, they call that, and transplant center, and also through cholesterol. Okay. Well, actually, we have found Neospora DNA in the colostrum of cattle and also in goats. Okay. So you might want to ask the question, what about toxoplasmosis? Does toxoplasmosis causes abortion in cattle? The answer is no, but not a definite no. Because actually, I've asked Dr. Dubey, okay, J. Prakash Dubey, who has been working for a long time in coccidia and toxoplasmosis, and of course neosporosis too. You see, he said he has done experimental infection in cattle with toxoplasmosis, and he gave me a definite no, that toxoplasmosis does not cause abortion in cattle, but it causes abortion in human, it causes abortion in goat, it causes abortion in sheep, okay, but not in cattle. Why? Maybe this is one of the subject that you can delve in, okay, in the future. Okay, so the life cycle of Neospora is that the dog will shed the feces, and then the feces, the oocyst, okay, the dog will pass the oocyst in the feces, and then the oocyst will develop uh, in the environment, and then they get ingested by these ruminants, and then it causes abortion. And if the aborted fetus are being eaten by the dog, so it goes like this. So this, you find this in the textbook. I'm not going to go too much into this. The next point is that what did I do? I did a serological survey of cattle, dog, and wild rats in the farm, okay, in the farm in Taiwan. And I found that they are 58% positive, dog 30%, and wild rats, the rats, okay, they are also 16% positive. So, well, what I did was that I took the rats, and then for the first time, I showed that the rat can serve as a reservoir host for neosporosis. So for this life cycle of sporosis, this is my contribution, okay? Reservoir rats. Of course, I took the rat, and then I isolated the neospora, and then showed that the neospora exists in the rat's brain using all those techniques, okay, like biochemical techniques, immunological techniques, and molecular biological techniques. So this is so. Well, anyway, the dog will eat the rats, and then the dog get infected. So the dog shed the oocyst, and then the oocyst will infect the cattle, and then tissue cysts in the cattle, and then they get well, the dog ate it, and then it's transmitted to the dog, or when the the cattle aborted, and this infected fetus also were being eaten by the dog. So it goes like this. And then if there is no abortion, then the calf are congenitally infected with neos- neospora. So that's where they move on to transmit the neospora to the offspring, okay, or to the fetus in the next generation. Okay, so this is the rat. Okay. All right, so the next point I want to tell you is that when you do a serological survey, you need to look at IgG and IgM, because most of the research papers that they send to me for refereeing, they only do IgG, they do not do IgM. And from here, we can see that kettles, okay, this is Neospora. 29% only have IgG, and 9% only have IgM. Okay, that means what does it mean? It means that if you only do IgG, that means you are only do you'll be only getting about this much, okay, 58%. But you'll be leaving out this 10%. So you need to do both IgG and IgM. One more thing I want to tell all the veterinary students or even medical students, that we learn in textbooks that first the IgM will come up, and then it will start to come down. Then the IgG will come up. Okay, that's immunological textbook. But but the problem is that you look at COVID-19. COVID-19's patients do not show this. First, the IgM will come up, then the IgG will come up. No, in this COVID-19's patient, both the IgG and the IgM comes up at the same time. That's why you get so many people being killed. That means there is a very strong immunological reaction. Okay, actually, most of the patients died due to this what we call the cytokine storm. Okay, in COVID-19. All right. So well, that's the human, and of course, if you is actually IL-6. Okay, so well, my point here is that you need to do both IgG and IgM. Okay, so for Neospora, the brain is normal, the spinal cord is also normal. Okay, and here we did a PCR of the aborted fetus, and from here we can see the brain. Okay, and then if you look at lane 7, this is the spinal cord. Okay, and then if you look at lane 18, this is the tongue. Okay, that means you can find Neospora DNA in almost every part of the fetus, right? So all the dog need to do is just have a bite of the aborted fetus, and then the dog can be infected. Okay. So what's the difference between Neospora and Toxoplasma? Here we look at this rock tree. Okay. For Toxoplasma, the rock tree is very short. For Neospora, the rock tree is very long. It comes down to the nucleus. Okay. So actually, there's the great difference. All right. This is produced by Dr. Ham Hill. And well, the next thing I want to say is that when you do testing for antibodies, what we did for this testing, we took milk, we took serum, vaginal secretion, and saliva. Okay, and then we know that all these are positive animals. So for 50 number tested, all 50, and then all positive, 100%. So from here, we can see that the serum and milk, they have the same, what you call capacity to contain these antibodies. So the next thing is that it is not necessary to take blood from the cattle. You just need to take the milk from the cattle, okay? And then you can test for antibodies, okay? So this, and the next thing is that presence of antibodies in milk correlates well with the serum. So milk can also be used instead of as antibodies for instead of serum test sample for antibodies. Okay, so how do you process milk to test for antibodies? Just very simple. You do the centrifugation at low temperature. You take out the butter. You know, the top part is the butter. Okay, and then after centrifugation, then the lower part is the skim milk. That means there are no butter in the milk. And then all you have to do is just add in like acetic acid, you know, to bring down the pH. So those, when you bring down the pH, is what we call the cottage cheese. Okay, and then what is left is the whey, and then you use the whey. You can concentrate the whey by using the Centri Plus Amicon. Okay, the whey tested for antibody. So this is how it goes. Okay, the milk, and then you centrifuge it, you get the skim milk, and then you add in the acid, weak acid. Okay, and then it well, it sinks down, it's sediment, and then this is the whey, and then you take this whey and then you put into Amicon, and then you spin it with a 40 kilodalton filter, so you can concentrate it. And here you can find all your immunoglobulin, and then you test your immunoglobulin for this, for your antibodies. So you can use what we call the bulk milk. Okay, so it's not necessary. Well, bulk milk, for example, if farm is negative for a certain infectious disease, it can be any disease that produce antibody. Okay, not Neospora, any virus or any what you call bacteria. Okay, you test, you use the bulk milk, you concentrate it, you look for antibodies. If it's negative, like for example, you may have 100 cattle, okay, that produces the bulk milk. So all you have to do is just take 100 cc, 100 ml. You concentrate it to 0.5 ml. That means you are concentrating it to 200 times, okay, and or maybe just 100 ml, 1 ml. So when the remaining 1 ml, if you test for antibody, is negative, it means your 100 cattle is negative. If it's positive, that means at least one of your cattle is positive. Then you can start to identify which one by taking each of the milk separately. Okay, so what is the take-home message? Concept of disease diagnosis, infectious and non-infectious disease, like I told you. And non-infectious disease for abortion includes chemicals, drugs, and genetic effects and everything. And necropsy of aborted fetus is very important for diagnosis, especially arbovirus. Virus that are being transmitted by arthropods are called arbovirus, arthropod-borne virus. Okay, and I have shown you that the fetus do not have this brain, cerebrum or cerebellum, and things like that. So you need to do a necropsy. And mosquitoes and culicoides are important vectors in the transmission of virus. Okay, this is written in textbook. And okay, how do you prevent this? You see, well, it has been said, but not really proven, that you can grow plants around your cattle farm to that mosquito doesn't like. So this is where alternative medicine comes in. Okay, and neospora is a major cause of abortion in cattle. Dogs can be its intermediate and definitive host. Rat could also be naturally infected with E. caninum and N. caninum and serve as a reservoir host. Okay, so since well, when you do uh, serological survey, whether it is neospora or virus or even bacteria, you need to look at both IgG and IgM. Okay, because certain cattle only show IgG, certain cattle only show IgM. Okay, maybe it's different period of being infected, and presence of antibodies in milk correlates well with sera. So you can just use milk instead of sera. So there's no need to take blood. Okay, and overall milk can be concentrated to check for to to identify an infection in the herd. This is herd medicine. Okay, so I just want to finish this with all the thank you, but I think we still have 10 minutes, so I'll just give one more this thing. Okay, actually, I myself experienced what is called abortion storm. Okay, in my experience, there was a cattle farmer. He has 250 cattle in his farm, and in within 2 weeks from I think May 30th until June 11th, 18 of his cattle aborted. Okay, so uh, if we look at the months of the gestational age of the aborted fetus, 3, 4, 5, 6, 7, 8 is 1, 8. So this abortion storm, you see, uh, within 2 weeks, 12 of the aborted fetus are 5 months and 6 months. Okay, this is actually by neosporosis, and so this is midterm abortion. So what did we do? Of course, we took the blood from 38 cattle and found that they were during abortion storm during these 2 weeks, and we found that 66% were positive out of this, and but only IgM, that's 10%. That means 10% show only IgM, 10%, 13% show only IgG, and 52% show both IgG and IgM. So if you do not test for IgM, you are going to miss out this 10%. Okay, and why does this abortion storm occur in this farm? Well, actually, 2 months before this abortion storm, the farmer started to plant his own grass. He bought a piece of land, a plot of land, he planted his own grass. And from there, he cut his grass and then he fed it to his cattle. Okay. But about nearly 2 months before, he also introduced what we call the TMR, total mixed ration. That means it's a big machine where he throw in all his the feed, including the grass, and then he churns it and it cuts the grass into very small pieces and let the cattle eat. So just about 2 months before this abortion storm, he used this TMR, total mixed ration machine. and also he also used his homegrown grass. Okay, and then that's why he got we call this point infection. That means we found that there were many dogs, stray dogs that go into his plot of grassland, and they were defecating. So we think that the feces of this dog contains this Neospora oocyst, and then he took this grass and then he mixed it thoroughly with this machine. So all the, the dog feces, you see, were evenly distributed in this cattle feed, and then he fed it to the cattle. Okay, so he got this abortion stop. Okay, so I guess I'll just have to uh, end with my with my talk here. Is already well, here is already 3:25. It's 3.5 hours ahead of your time, and just say thank you for your attention.